This is a model for vaginal hysterectomy. These are the instruments needed. Scalpel with a size 10 blade, tooth forceps, Alice clamps, curved or Heaney needle driver, straight needle driver, a single tooth tenaculum, sutures, either CT1 or CT2, mezzamam scissors, curved mayos, and suture scissors. The first task involves incising the cervico-vaginal junction with a scalpel. You need to palpate the edge of the foam cylinder underneath. Grasp the anterior cervical lip with a single tooth tenaculum and start your incision just at the edge of the palpable foam cylinder. Once you're ready to incise the posterior lip, switch your tenaculum on the back lip of the cervix. The second step involves performing anterior and posterior coptomies with mezzamam scissors. We're going to start with the anterior copotomy. So place an Alice clamp just on the vaginal mucosa. Ask an assistant to pull it up. And using non-tooth forceps, find and use your mets 45 degrees to the cervix. Cut an incision in the thinner silicone skin beneath the vaginal mucosa. Perform a posterior copotomy by identifying the thinner silicone skin, again at the back, and keeping your mezzamam scissors mostly parallel with the foam cylinder. Involves taking 3 pedicles in sequence, evenly spaced on either side. Curved Rogers clamp is used. The first pedicle is the uterosacral ligament, and so the angle needs to be approximately 45 degrees. Try to slide your pedicle off the cervix foam. And cut all the way to the tip, turning your scissors around to ensure that the whole tip is cut off. Okay, so transfix your first suture. The second and third pedicles are on the cardinal ligaments, and so again, try to take them slightly more parallel and sliding off the foam. Cut them with curd mayos all the way to the tip. Since these are considered more vascular pedicles, just suture them and tie at the back of the clamp without transfixing. And off. Make square, tight knots. Thank you. The third pedicle, try to take within the cylinder, a little bit higher off. And off. So for the fourth step, remove the uterus by removing the stick. And you will see that you have an incision at the top that you need to fix with a Vicryl suture. I'm using a Heaney needle driver, and this shows how a Heaney needle driver should be loaded. So the tip of the Heaney needs to be perpendicular with the loaded needle. This shows you how to suture in a deep hole. Maybe just, if you don't mind stabilizing this.